Hello, I'm here to present my group's research where we looked at prostate cancer abstracts that were accepted to the ASCO 2023 meeting, and we're looking to basically see how they adhere or did not adhere to the ASCO Language of Respect guidelines. And so essentially, just for some background, the ASCO Language of Respect guidelines were adopted in 2020 as a way to promote inclusive and patient-centered language within all of our research communications. And so basically these guidelines follow and revolve around these three core principal directives, which is do not blame the patients, respect the role of the patient, and also do not dehumanize patients. And so together with my team and I, we went through all of the prostate cancer abstracts that were accepted in 2023, and we looked for every patient referring statement. Based on those statements, we referred to them as whether or not they complied or did not comply with one of the three appropriate directives. And so together we found that a majority of prostate cancer abstracts actually had at least one statement that did not adhere with the ASCO Language of Respect guidelines. And so we have this breakdown here of compliance across our three different directives. And as you can see here, do not dehumanize patients was the most commonly not complied with, whereas respect the role of patients was pretty compliant all across the board. We also went and looked at predictors to see if there are any factors that might associate with having a higher rate of non-compliance. And so we looked at different sessions types, such as publication, poster, oral session, research types, so clinical, translational, or basic, represented institutions by the authors, so whether this would be a single institution or multiple institutions, as well as represented countries, so single versus multiple countries. And finally, we looked at the language of the primary institution of the first author. And so based on our analysis of both univariable and multivariable analysis, the only predictor we found that was significant was having first authors that were representing non-native English-speaking countries. And so this would involve countries such as, for instance, Mexico or Spanish or France, where English is not the primary language, versus Canada, the US, or Australia, where English would be. So ultimately, this goes to show that we do need to have an increased awareness of these language of respect guidelines so that we can promote inclusive and patient-centered language both in our research communications as well as when communicating to our patients directly. And so this can be done through various methods, and we suggest that some ways of doing this would be through translating the language of respect guidelines into multiple languages, or also increasing global outreach to the global oncology community to reach more oncologists so they could be aware in their practices.